Good morning, good people from wherever you're watching us from. Welcome to the GTV. This is the Afya program. My name is Caroline Bide. And remember, you can be part of our programs through supporting us via our till number that is 96268959, 96268995. And you can also keep your comments and questions coming through the number on your screen that is 0711 3528883. Today we are with Nurse Rhoda in the studio, and she's no longer a guest. Niliwaambia yesi mgeni tena. She's part of the family, and she has been helping us understand more about health. And as I told you that it's so important for us to be healthy, that is emotionally, physically, psychologically. Every dimension of us should be very healthy. So welcome back to the program. Kindly introduce yourself.
Thank you so much.
You're welcome.
Good morning, viewers. My name is Rhoda. I'm happy to be here. Thank you, the GTV program of Afya Leo, for including me in your daily programs. I'm so glad even as we continue. So welcome. The GTV loves you.
Okay, today we are talking about urinary tract infection, that is UTI. If you may start us off by letting us know what is UTI.
Thank you. UTI, or urinary tract infection, this is an infection of the upper or lower urinary tract of a human being. Yes.
Okay, and does it affect both male and female?
Yes, it affects both males and females because both of them have the system.
Okay, and what are the causes of UTI?
Okay, causes of UTI, actually urinary tract infection is an infection like any other which comes to the body. And various infections have various organisms that cause. UTI is caused by bacteria. It can also be caused by a virus, and it can also be caused by microbes. These are microorganisms that in the body, and they enter the body through various routes, and also they can enter through many things. And also we have bacteria that live in the body normally. And sometimes if there is an infection or if there is an external attack of the body system, they become an enemy of the body. So even the internal bacteria can cause once it's attacked from outside. So I said it can be caused by bacteria, viruses, other microbes, and so on and so forth.
And can it also be transmitted through sexual intercourse?
Okay, it is very rarely transmitted, but it can also, when it's UTI, you know, remember the anatomy of a human being, the reproductive system, and especially in women, the urethra is next to the vaginal entrance, and therefore an infection which affects the urinary tract can also be transferred to this, the reproductive tract, and from there now it can be transmitted. Yes.
Okay, and you talked about bacteria, you talked about
Microbes, viruses.
Where are these bacteria and microbes? Ama ziko tu kwa mwili?
Okay, I would want to explain a bit. I said there is an infection that comes from the external environment. What I mean by that is external unwanted organisms enter the body through the systems. For example, you know, we are used to passing our urine in various parts, There are various forms of sanitations. There are various ways people use and methods people use to empty their bladders. Others, there are various ways they handle their organs. So, for example, from our sanitation, from our environment, external environment, we can find organisms, or rather, in the local language or in the layman's language, it is called dirt, uchafu. But with us, we say they are microbes. So once they come from the external environment, through maybe the touch of our hands, and others through contact, yeah? So contact can be with a human being, with an organism, or sorry, with an object. So from the air, from the waters that we use. So from there, we can have external microorganisms getting into our bodies. And therefore, when the microorganism is getting into the body or into contact with our bodies, it is not a bacteria. But once it gets in our body, the body will react. Remember, there are other bacteria that are normally in the body, and they are there to defend our bodies, especially in the reproductive and urinary tract organs. There are some microorganisms, there are bacteria naturally there to prevent infections. Now, when other microorganisms come from the external environment, these other normal ones, they react. And therefore, during this reaction, now we get an infection. That is where an infection comes in.
Okay.
Yes.
And how can I tell, or rather, what are the signs and symptoms of UTI?
Okay, once someone is infected with a urinary tract infection, there are various signs and symptoms. Signs are things that you can see, or the patient can see. Then symptoms are things that the patient says or experiences or feels. So we have signs and symptoms, or rather they are called clinical presentation. So some of them are like pain during micturition. That is pain when you are passing urine. Somebody will come and say, oh, I'm passing urine with a lot of pain, and I'm not able to pass urine well because of the pain. Then also there is frequent micturition. Micturition is urination. So someone will come and tell you, I'm going to the loo every other time. I'm feeling like running. After that, I feel like running again. So that is another sign, because it's observable. Even if you sit with a patient here, she just excuse herself or himself. So that frequency is what is called frequency in micturition. We still have something we call lower abdominal pain, especially on the pelvic region. Pelvic region is below the lower abdomen. That is the area where we have the ureters, the site of the kidney, and etc. So that is another one, pain on the lower abdomen. Then we still have somebody will come with hematuria. Hematuria is blood in urine. They are passing urine, then they notice there is blood. Others will come with pus in urine. Even others will come with high fevers. These high fevers are associated with frequent passing of urine and pain in passing urine. And at late stages, others will come with nausea, vomiting, lack of appetite, and so on and so forth.
Okay,
Yeah.
just hold on there. Keep sending your questions and comments via the number on your screen, 0711352883, 0711352883, and Nurse Rhoda will be able to tackle each and every question that you will be sending to us. So we'll be back after the short break.